All right, let's get an update now on the impact of Cyclone Freddy, which has swept across southern Africa, damaging parts of Mozambique and Malawi. Since yesterday, the picture in Mozambique in particular has worsened. And I'm joined now by Guy Taylor, Chief of Advocacy, Communication and Partnerships for Unicef. Guy, thank you so much for joining us. So my understanding is that in total, between the two countries that have been repeatedly battered by Freddy, we're now looking at over 300 people dead. Is that correct?
That's what I understand, yes. For Mozambique, we've seen the number of deaths has gone up quite substantially. Yesterday, we saw the number at 53. The day before, it had been 21, the day before that 10. So I think what we're really seeing here is the full scale of the impact of this cyclone start to become a little bit clearer as information begins to come in. But I would say we're still at a fairly early stage of the response. I mean, internet connectivity, which has started to enable coordination a little better, only came back on a couple of days ago. Many of the people who are affected are in very rural, remote areas. And so the information is only now just starting to come in and to be tallied as the response ramps up. So I think those numbers are quite likely to continue to rise in the coming days, unfortunately.
Yeah, that is very distressing news. Has the worst of the storm passed, though?
Well, I think the winds have certainly passed. The rain, we're a little bit less sure about. We'll have to see how things play out in the coming days. But I think what we're very worried about at Unicef is what the prolonged impact will be of the devastation which Freddy brought, and also the flooding. So many areas of Mozambique, particularly around Zambezia province, where the cyclone made landfall and where we were until just a couple of days ago, are still very, very badly flooded. People have lost their crops, they've lost many of their belongings, and the presence of so much water creates a very serious risk of waterborne diseases, things like cholera. The country is currently facing an outbreak of cholera with more than 9,000 cases as of today, around 1,000 cases happening a week. We have the risk of diarrhea, one of the biggest killers of babies and children. And we, of course, have a risk of malaria. So the impact over the longer term could potentially be quite a lot more substantial, particularly for children. And I would say things like access to basic services, maternal, newborn and child health care, education, there's a real risk that those will be cut off for prolonged periods of time. So we're seeing a concerted response from the UN, from UNICEF, from the government, but the challenges are pretty substantial.
You've mentioned as well that you haven't been able to access and get information from all the areas that have been affected. Talk to me about what you suspect, which areas, how large the areas are, and how crops might be affected.
Well, crops have certainly been seriously affected. We're talking about latest estimates from the government that around 500,000 acres of cropland have been affected. And, that's a kind of an abstract statistic, but it really plays out when you talk to people in the villages who say that they now don't know how they're going to feed their children. They don't know where they're going to get food from. These are people who rely on subsistence agriculture to survive and as their main source of sustenance and of revenue. So the impact of that on people is tremendous. In terms of access, the main road, the N1, which is a trunk road running up and down the country, has been cut off in some places by very serious flooding, and that is going to hamper the relief efforts because it makes it much more challenging to bring in the kind of supplies that are needed. So luckily, UNICEF had been working with the UN and with government to pre-position large quantities of supplies before the cyclone hit, and we're now working to mobilize those to the most impacted children and families. But it really is making the response challenging.
So, as you said at the beginning of the interview, in Mozambique, officially now the death toll is 53, but you tragically expect that to rise because you're still making contact with flooded areas. Could you give me a sense, and I would imagine these are only rough estimates, but how many people you think have been actually affected by the cyclone?
Well, it really is very hard to say. I mean, I would say that the number of people estimated to be affected went up quite substantially yesterday, more than doubling to more than 250,000 people. And so, I think we will see perhaps today, tomorrow, in the following days and over the weekend, probably a more fulsome and more settled estimate of the number of people affected, but it's certainly in the hundreds of thousands. And these are very abstract numbers. But when you talk to people, I was talking to a young mother a couple of days ago in Kelimani, and she said to me, like, I haven't lost hope, but I am very worried about how I'm going to find food and water for my children. And that is really, a heartbreaking story. And there are thousands, probably tens of thousands of mothers of children who are out there tonight in similar situations. So the impact in human terms is really very tragic, and these people really need urgent support now.
Talk to us a little bit more about Cyclone Freddy. It touched down twice, which is apparently completely unheard of. Tell us about the character of the storm and any clues as to why it's behaved the way it has.
Well, I'm not a meteorologist, but I think, the settled consensus seems to be that this is the impact of climate change, and Mozambique is really bearing the brunt of that climate change. This is a country which is now experiencing on an annual basis serious tropical storms and cyclones, and it's a country extremely vulnerable to these weather events as well. A very long coastline with many low-lying cities, populous areas close to the coast. So when these cyclones hit, they really cause a lot of impact, and it's children and it's families who suffer the most. Mozambique, it's important to remember, is also facing multiple humanitarian challenges at the same time. There's 2 million people in need of humanitarian support in the north of the country. The country's battling this cholera outbreak. We're leading a large-scale response to polio. And this is a country which is already, has very high rates of poverty. So it's the humanitarian community in Mozambique is very overstretched at the moment, and it's very challenging to respond to all of these competing crises.
With that sort of context, are there enough people on the ground to help? Is there enough humanitarian support coming into the country, and even for the long haul, with crops potentially devastated as well?
Well, that's right. And I think the thing with these natural disasters is they capture the headlines for a couple of days, and then the longer term response can kind of lose people's attention. But we really do need a substantial, sustained response to this crisis. UNICEF's calling for $30 million in support to enable us to respond in an effective way to this crisis and to the cholera outbreak which the country is facing, and support children and women through these difficult times. I think the government is stepping up and making a very concerted effort to respond to this crisis, but it's really a big challenge, particularly, as I said, with the multiple humanitarian crises which are taking place at the same time.
Oh, well, thank you very much for that update. It's distressing indeed, but as you say, we need to keep it top of mind because there is so much help that is required in Mozambique and, of course, also in Malawi. Guy Taylor, Chief of Advocacy, Communication and Partnerships for UNICEF, coming to us live from Maputo in Mozambique this evening. Now, still